I think the most significant barrier that I've broken in my career is truly just being able to be at the table as a African American female, and be able to have a voice for the community. I definitely hope that watching me inspires others because honestly, people can see that they can do it. I have a lot of outreach from young women who are interested in health professions, and they say that it's because they see a woman at the table that it's inspiring to them. And then certainly I have a lot of people that are African American that just they're inspired because they see someone that's in leadership. So I think being able to see it helps people believe that they can achieve it. I was inspired to be in healthcare. One, I loved math and science when I was in high school. I had an aunt who worked in healthcare, and so spent a lot of time with her, quite honestly, at the hospital. Although everyone else in my family was in education, I really liked helping people in the healthcare space. I didn't necessarily know about public health when I went to the University of Michigan, but fortunately, I was participating in a pipeline program that allowed me to look at healthcare administration. And honestly, once I did it, and I think my junior year, had an opportunity to have an internship. Really from there, the rest, as they say, was history. I absolutely loved the opportunity to be able to be helpful, and to do that in a healthcare setting. Wow. I hope that my leadership legacy is one of service, and one of being able to actually make a difference. A lot of what many of us do in healthcare is really try to understand how we can help people to be healthy. So close the gaps that exist around health disparities. So I'm hopeful that my legacy will speak to a contribution that I was able to make, and be able to close that gap in health disparities. I am really trying to secure my legacy and actually just make sure that the time that I've spent in healthcare makes a difference, quite honestly, by mentoring, and encouraging other people to come into the space. I'm fortunate to spend a lot of time with young healthcare professionals and really helping them to see the possibilities in nonprofit healthcare. Within my organization, spending a lot of time mentoring and partnering with leaders really of all stages of their career to stay encouraged and to be a part of the healthcare system. It's really inspiring to be able to work with young people who are interested in healthcare. I remain very hopeful, and positive about what the possibilities are. Healthcare, as we know, is something that's critical that everyone needs in their life at different stages. And it's actually a choice, right? People can use their skills and talents to be in any profession. So it definitely still excites me to have people who reach out and who are interested in health professions. And I truly believe that they're the future. So I spend a tremendous amount of time encouraging people to come into the career. Wow. I've had a few moments where I could realize the power of my influence. And I know that, the influence that I have is broader than just the role or the position that I have. Some of it is just having longevity in the community. Very recently, we at Henry Ford really embarked on a very ambitious project, a $3 billion renovation in a community that really needs that investment. And I think the power of my influence was really one, just being able to sit with the community and help them to give us their voice and be a part of the project. So most recently, that would be one. When I look back on my achievements and think about the contributions that I've made, I do hope that honestly it's the people that I've been able to touch in the profession. I've had the privilege of being able to mentor many and see them go from their college career into professions. I've seen professionals that I've been able to promote, mentor, and or support in their careers. So I think the best legacy for most of us, right, is being able to see the impact that you've been able to have on people that you've been around. The best advice that I received was really to be humble and to really remember who you are and why you're doing what you do. I think it helps every day because it helps to keep you focused and grounded and partnering with everybody and understanding that each of us really are approaching things as humans and committed to partnering. So it's not your title or your position, but it really is just being connected with people as people. If someone's seeking to follow in my footsteps, I normally will give people very similar advice to the advice that I got, which is be in service with the work that you're doing. be focused on making a difference, and definitely be humble and focused on partnering with the people around you. An historical person who inspires me is Rosa Parks, partly, of course, because she was someone incredibly influential in the civil rights movement, but even more so because, of course, she relocated to Detroit, and I had the privilege of meeting her while she was later in her life, and quite beyond those civil rights moments, but she still had such a quiet passion and resolve for what equality meant, and so it still is incredibly inspiring to me. I am very excited for the future of health, as we call our project within Henry Ford Health, and not just because what it means for our health system, but quite honestly, the renovation and revitalization of the community that we're in. It is factorial, and I am very excited about the impact that it's going to have on health for many generations to come. My excitement about the future of health and Destination Grand, which is a component of that project, is really, if you look at Henry Ford Health, we've been in the community for over 100 years delivering health care. We've done that in a facility that we've renovated over a number of years, but the project that we're embarking upon now allows us to have that actual hospital expanded, have private rooms, and for me personally, being a lifelong Detroiter, it's an opportunity to have in the city of Detroit a state-of-the-art facility, very similar to what we have in some of our suburban communities, but more importantly, it's also going to have housing, so the community that surrounds it will have some significant advantages around affordable and new housing, and there's a research component to it that really focuses on how we can address disparities in healthcare. So very excited, honestly, just about what it means, not just in the short term, but quite honestly, probably 100 years from now, what it can have impact for in the community. Being one of the Power 50 means a lot to me. It is always very inspiring to be recognized by your colleagues for what you're doing. So it really has been an enjoyable experience being able to meet the other honorees and being able to just really hear and understand the impact that I guess we're all having on the community. So it truly is humbling to be a part of the Power 50.